Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about managing peripheral neuropathy with vitamin E. So vitamin E is a very, very powerful antioxidant that reduces free radicals and free radical damage of the nerves, blood vessels, and other surrounding tissues. It is commonly used for these purposes. It's commonly used to repair free radicals, for example, in the skin, but it works really, really well on the nerves. The interesting thing with peripheral neuropathy is the vitamin E has also been shown to be neuroprotective, meaning that it can actually protect the nerves and prevent damage by the antioxidant benefits that it will actually give to the nerve. So some of the damage that it can prevent is mitochondrial damage. You'll actually keep it from being able to damage the mitochondria through free radicals. It protects the nerve cell body so that you can't degenerate the cell matrix itself and have it start to die off. It prevents damage to the DNA and RNA substances inside the cell body, all through the antioxidant mechanism of breaking down and preventing free radical damage to these cells. So vitamin E. Typically, though, vitamin E is utilized as a neuroprotective vitamin in toxic type neuropathies, where you know it's going to actually do that free radical damage. So one type of toxic neuropathy that we have studies showing it is very beneficial on is in cancer patients to prevent damage from chemotherapy. It has been shown to work very well and will prevent that damage in many individuals. So it's something that should at least be considered, at least be discussed with your doctor if you have a possibility of getting chemotherapy induced toxic neuropathy. So I haven't seen, as we go through the studies, I have not seen any major benefits of saying, okay, I'm going to add vitamin E to all my peripheral neuropathy patients, because the neuroprotective benefit is really for the antioxidant effects, which can be done with vitamin C and some other vitamins. So let me give you a little bit of background of how you'll use vitamin E. Vitamin E, as we know, is fat soluble. So there are two types of vitamins: water-soluble vitamins, which are washed out of the system quickly, and fat-soluble vitamins, which are absorbed into the fat and they actually stay in the system longer, which increases your risk of toxicity. Therefore, vitamin E should be taken once a day, not twice a day, as some of the water-soluble vitamins are taken. We usually do a maximum dose of about 300 milligrams per day, and you can get it in food sources as well. So a lot of times, if I'm trying to do the neuroprotective function, I will actually give it through a supplement. But many individuals can get the sufficient antioxidant benefits by eating some of the foods that are rich in vitamin E. Things such as vegetable oils, nuts, especially almonds, hazelnuts, pine nuts, peanuts, and Brazil nuts. Seeds, such as sunflower seeds, turnip greens, peanut butter, of course, because of the peanuts, spinach, avocado, tomato products such as tomato paste, tomato sauce, and puree. And then fortified foods. Vitamin E is fortified foods. Sometimes you will get those in cereals, fruit juices, margarine, and some of the other spreads that you'll use on sandwiches and so forth. So vitamin E is absolutely a beneficial vitamin for peripheral neuropathy, especially toxic neuropathy, especially in the case of preventing damage in chemotherapy-induced toxic neuropathy. So this is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 76.